Hi everyone, thanks for coming again. My name is Marissa Brzezinski and I work for the Brain Injury Support Team as the Eastern Washington Support Group Coordinator. I also live with a sports-related brain injury and I will be your moderator for this evening. And so what we're going to do is we're going to start off with a few announcements and then I'm going to get each of our panelists to introduce themselves, let you guys get to know them a little bit, and then we will start right into the questions. So the first thing is that you are more than welcome to ask questions throughout the panel discussion, so long as it pertains to the topic we're currently talking about. So if you have something like that, just raise your hand and we will have Elaine come around with the microphone so we can all hear you. Otherwise, just write your questions down on the pieces of paper that can be found in your folders, and we will have a segment at the end where you can ask all of those questions. And the last thing is that this panel is to address the components of concussions and sports-related injuries, as well as the prevention and management of them. And so we're going to go along those routes. So let's begin. Let's start with Ramona. Do you mind starting?
I'm Ramona Pinto. I am the Eastern Washington Resource Manager for the Brain Injury Alliance of Washington. I work with brain injured individuals, concussion, that kind of thing. I work with the caregivers as well. What I do is actually connect people up to the resources that they need. There is no charge. We're a 501c3, so we do not charge for services. It can be anything from filing for Social Security disability to just simply finding a support group and knowing that you're not alone in the journey. We have a lot of good connections with also the Spokane chapter. So there is the Spokane chapter. We're the only state that has a chapter in the state area. All the rest of them just consider the mega areas of their states. So feel free to stop by the booth, find out that we have support information. There's a lot of information that we have that we obviously didn't bring with us, but we can always get it to you.
Hi, my name is Megan Lust. I'm a physical therapist with physical therapy. And I got my doctorate of physical therapy in Texas at the University of Texas Medical Branch in Galveston. And I see athletes and individuals not just post-concussion from a sport, but even concussions from car accidents and the like. And I treat patients for vestibular issues, cervical issues, kind of give them, sometimes I'm the voice to a lot of their issues because I see people for 45-minute sessions. And so a lot of times I'll get to know them a lot and be able to provide them with the right resources or get them in the right direction. If they're having trouble with school, I can try to contact their school or their doctor to contact their school to try to get them in the right direction.
I'm Ryan Baker. I'm a pediatric sports medicine provider. I work at Shriners Hospital for Children. I did medical school in Cincinnati, at University of Cincinnati, did residency at Cincinnati Children's, went to UCLA for a year, and did a primary care sports medicine fellowship there, and then I've been in Spokane since 2012 again, 2011, 2012, sometime around then. And so I used to work for Providence, and then I've been at Shriners, and mostly it's sports concussion related issues and other sports injuries, but trying to identify things. And I definitely slant only towards kids now that I'm at Shriners because I can only see people up to 18. And so I definitely slant that way. And I think there's a handful of us in the country. Most of them are in Seattle, just in general. Oh, and I'm a team doctor, I guess, for North Central, Shadle, and helping out at Mount Spokane and then Medical League as well. So busy from that standpoint as well.
So he's on the sidelines as well. So I'm Heidi Peterson. I'm a licensed athletic trainer. I've been working in the field of sports medicine since 1977, so longer than most of you have been alive. When I first served as a student athletic trainer at Citrus College in Azusa, California. Since then, I've been employed in a host of professional settings as a certified athletic trainer. with professional and national teams, with 8 NCAA Division I university athletic programs, including Stanford and Gonzaga University, as well as with multiple high schools, including since 2009, I was athletic trainer at Shadle Park for 4 years, North Central for 3.5 years. Over the years, I've provided medical care for multiple individual and team championship level athletes competing at the state, national, international, amateur, professional levels. I'm kind of the historian of concussion care of this group. For the past 2 years, I was hired to go back to work by Multicare Rockwood. I facilitated the founding and formation of a Spokane area sports medicine, sports-related concussion care group consisting of area sports medicine fellowship trained physicians, so the team doctors for all of our area high schools, school nurses, physical therapists like Megan, and the athletic trainers that are working in the schools. The group has transitioned to include all youth sports injury-related concerns and is now known as NEWSMAC. I can't say it, Northeastern Washington Sports Medicine Advisory Committee. Our group collaborated initially with concussion care, that's what brought us together, to improve the recognition and management of concussions suffered by school-age students, as well as educate our medical and general community about the topic of sports-related concussion. And then the mission of NEWSMAC is a little bit broader, is to provide information, vision, and guidance to our community while emphasizing the health and safety of Eastern Washington youth sport participants.
My name is Christine Pizzardo. I'm a neuropsychologist. I got my PhD at the University of Southern California and then did a 2-year postdoctoral fellowship at the UCLA School of Medicine in pediatric and adult neuropsychology. I've been practicing in Spokane since 2002, and I co-own a mental health clinic here called Northwest Neurobehavioral Institute. So I see kids and adults with concussions. I see kids and adults with any sort of brain-related problem, but I see a lot of people with concussions, including sports concussions. So I will do neuropsychological evaluations to assess their cognitive functioning and also psychological testing to assess any psychological factors that might be contributing to what's going on, and then refer for various treatments or services as necessary.
Thank you. So our panel of experts here work with athletes, children, adults from all different areas and all different perspectives. And so we're going to go through some questions and have a bit of a discussion to see how all of these perspectives intertwine and how they may impact each individual. And so I know in the video they talked a little bit about what a concussion or TBI is, but we're going to start off with what can be classified as a concussion or TBI and what happens to the brain after that. So would anyone like to start?
Yeah. So the definition of a concussion has changed a lot, and there often hasn't been much consensus, but generally you have to have some sort of event that then causes dysfunction after. If you have dysfunction without that event or trauma, it can't be a concussion. Also, if it's weeks between that trauma and the concussion, that's not a concussion. It has to be approximate to the time of the brain dysfunction. And there's no good way, that's black and white at least, to diagnose a concussion, what consists of concussion. If you take the symptom list, like from the Sports Concussion Assessment Tool, the SCAT, if you ask someone that has the flu, they'll feel a lot of those same symptoms, right? So you're trying to pinpoint, and that's where your history is honestly probably the most important. Try to pinpoint some time point where, whether it was trauma to the head or to the body, some force that happened that got transmitted to the head is really all you need. And then some sort of dysfunction that likely started within 24 to 48 hours of that moment. And so I think that's the simplest way to think about it, at least in my hands.
I would just add, because I think it's relevant to this question, the degree, because that's important, I think. Concussion and post-traumatic or traumatic brain injury are interchangeable terms, but a mild concussion or a mild uncomplicated traumatic brain injury, typically people recover within 10 to 14 days with no long-term consequences. And that's generally speaking
a loss of consciousness of under 30 minutes or no loss of consciousness, and clear memory for before and after the event. A loss of consciousness of more than 30 minutes, or having a lack of ability to form new memories for more than 24 hours after that, then you're moving into more moderate brain injury. And then a severe traumatic brain injury is, those things are worse and take longer. So I think it's really important in this discussion to talk about the differences between a mild concussion and then a more moderate or severe concussion or TBI, because those are totally different events.
And we won't know it's a mild concussion or a mild TBI until the person has recovered, more or less, in a general sense. So there's no way you can say on an initial, it wasn't that bad of a hit, or they didn't seem to have that many symptoms initially in the first 24 to 48 hours. It's only when the sequelae has kind of passed through it that we're able to differentiate between sometimes like a football player having a blow to the head, or a volleyball player or a soccer player, whether their symptoms are going to resolve in 10 to 14 days or it's going to take longer. We don't know until. So we've gone away in sports from labeling things as mild and moderate, because we're not dealing with the loss of consciousness for 30 minutes, the comas, we're dealing with usually a mild concussion. But when we say mild concussion to a coach or an athlete, they make incorrect assumptions. So we hesitate to use that terminology with them, because we don't want them to think, well, that I can go to the movies with my friends tonight because it's just a mild concussion.
I know that with my sports injury, so just a little background, I was actually doing sit-ups in the outfield. I used to play softball, and a softball came and they hit me right in the forehead, and I went back, and I lost consciousness for 30 seconds or whatnot, but when they went to say, hey, this is what you have, all they said was mild concussion, we'll see how long it takes before you recover. They assumed that it would take the 10 days. I was not one of the lucky ones in that regard. But I was curious if having more than one concussion in sports can impact mild, moderate, severe, and how that might interfere with an athlete going forward with sports.
As a bit of background, every concussion is different because everyone's brain chemistry is different. There's an expression that we use in medicine: what you bring into the concussion is what you take out of the concussion. So if you have someone that already has some sort of brain chemistry, I don't want to say dysfunctions, that's not the correct term, but some sort of brain chemistry, ADHD, some depression, anxiety, any of those things that are common with teenagers, that can change the way, in the highway example, that highway rebuilds itself. So that's part of of what you're talking about, of how that affects you. So it's hard to say if someone has 3 concussions, if they're going to have this outcome, or someone has 1 concussion, because it depends on what the person brings into that. Right.
And there's no magic number of you've had too many concussions. It's really based individually, because I've had some patients that have had 1 or 2 concussions, but they have a significantly prolonged recovery requiring lots of different services, versus ones that have had 3 and they still recover within maybe 7 to 10 days. And one of the caveats on time in terms of typical recovery, like adults, 80 to 90% of adults, so this is above college age, heal within that 10 days. Kids, well, adolescents specifically, at least a lot of the statistics that have come out in the last year or 2 are closer to 21 days. So 67% of adolescents will be healed within 21 days, not 8 to 10 or 7 to 10 days. Younger kids, pre-adolescents, are usually typically a little bit quicker. And then as you get to college age and closer to adulthood, you're more typically recover within that 7 to 10 day time frame.
And that's what I kind of see. I typically don't see the ones that recover within 10 to 14 days. By the time I see them, they're the ones that aren't recovering. They have multiple dysfunctions. Depending on what is affected, is it is it more of a headache or neck pain, or sometimes it's a vestibular dysfunction, that system gets rattled around. It can even have a concussion. Those prolong recovery rates a lot. So if you have a vestibular concussion, you're looking at 6 months to a year sometimes. So, and every hit's different, and what part of your brain gets a little damaged is different. And typically those adolescents, because they're still forming so many new connections in their brain and their brains aren't fully developed, and they come in with a host of other things going on in their lives and in their brain chemistry, it's variable. And it could be 1 or it could be 10 concussions.
And God knows what else they're doing in adolescence. Smoking pot, cigarettes, vaping, drinking, anything else, which I'm sure
Poor
interacts into
nutrition,
that.
poor sleep.
Huffing, yes. There's multiple things that are also
Texting, because it's a screen, and tell a kid not to use a screen. Good luck.
Chronically sleep deprived. Chronically sleep deprived is kind of a key thing, and poor nutrition is kind of a key thing with adolescents.
And I don't usually see them until it's down the road a ways, because they probably may have been diagnosed with a concussion, but then all of the issues that are coming up again because of being an adolescent, then they've got those issues of, I just can't figure out what's going on. Then we have to go back and figure out what's going on. Is this something, are the lights flashing too much? Are they bothering you at school? We need to go back and look at what services they might need, like an IEP or a 504, to adapt to what's going on, regardless of whether it's a concussion or not. Something's going on, and then we need to get them, get a neuropsych evaluation to go forward with more treatment.
So one of the common questions that we tend to get is, does a concussion or TBI always have to involve any form of loss of consciousness? And so I think the general consensus for that one is probably not, but I'm not familiar with that, so.
Yeah, it used to be, so even the Camp 2 guidelines, I think it was.
Back in the day.
Back in the early 2000s, if you didn't have loss of consciousness, you were allowed to go back into the football game, as long as you seemed normal. And I still remember watching a Cincinnati, this is when I lived in Cincinnati, watching a Cincinnati Bengals game, and TJ Husmanzada, who played at Oregon State with one of my buddies actually, he was lit up, obviously looked concussed, but he didn't pass out during the game, and he was back in the game, and this is probably 2006 or 2007 or so. And things have rapidly evolved.
Yeah, I can tell you, we didn't view headache as you got your bell rung. You have a headache. That's not a viable symptom enough to keep you out of the game. One of the blessings of doing this for a long time and of social media now is that I have contact with kids that were my athletes back in 1982. And I have one in particular that was my athlete in 2002 that we returned to play with a physician because it was the NFL guidelines, it was the latest research, it was what you do, it was just a headache. And I worry about him. I worry about how him returning to play affected his ability to make a living and to do, thankfully he seems to be very successful, but it's still someone I think about specifically because it was just, you got your bell rung, you can go back in the game. As long as you didn't get knocked out, the guidelines or the rules, the best medical information at the time was it was okay to put them back in the game. So loss of consciousness, no, it has nothing to do with a brain injury.
I want to touch a little bit on returning to play because I know when I was playing, a lot of athletes had that same mentality. I just have a headache, I'm good, I'm going to go play, my team needs me, all of that stuff. And so at what point is it okay for an athlete to return to play, and in order to get to that stage, what might a proper treatment regimen be, and how is that determined?
It's a big question.
It is a big question.
I see return to play different from exercise and returning to learn. And so I'll often have kids exercise early, which is a recent, at least formal change that's been going on. I think people have known that it was probably should have been done earlier, but it was recommended to keep them out. and make them rest the whole time, which ended up being detrimental. But when I tell kids to exercise, I'm like, that is not your first step to your return to play protocol, which also isn't evidence-based, by the way, it's just expert opinion. And so I always try to mutually exclude those two parts.
Yeah, I was going to say, now the recommendation for rest is just 1 to 2 days and not being removed from stimulation. So not sitting in a dark room, not being off all the electronics. I mean, that was the recommendation just a couple of years ago, but now we know that is not helpful. And your body deconditions so quickly that if you're not active, you start to have symptoms that you think might be related to the concussion because you're achy and you might, feel dizzy when you stand up. You've been laying down for days at a time. So there's the rest and then the aerobic exercise, but not to the level that it would exacerbate symptoms. So everything has to remain symptom-free as you're moving back toward return to play. And then a gradual, you can probably speak more to this, but kind of non-contact, and then contact and then return to sport. But it's a stepwise process, always making sure that the symptoms don't come back.
So the group that NewsMac, what we put together was a document that reflected the best practices, and it's constantly being modified. But what we divided return to life into two components: return to learn and return to play. Return to learn first. And return to learn means back fully engaged in all of your normal school activities, social activities, choir, band, because we don't think of choir and band as being exertional necessarily, both physically and mentally, but back to all those activities before we even initiate the return to play, return to sport component. It's funny to me, and I don't mean funny haha, but just an interesting concept of in general with health. The more sophisticated that we've gotten with medications and surgeries and treatment protocols and all these things, it comes down to sleep, like I said in the video, sleep, nutrition, what was the third one? And exercise, sorry, my mind blanked, too many concussions. But exercise, and those truly are how our body responds best to recover from a whole myriad of different health conditions. Being sedentary, not eating well, and not sleeping well is horrible for almost every part of our body. We also, as little as 2 or 3 years ago, I worked with providers that would hold kids out of school for weeks at a time, even months at a time. And what we found is that let's take a kid, not only take them out of their sport, which is their socialization, but take them out of school and sit them at home. Are you going to get depressed? Yes. Is that negative brain chemistry? Yes. Are you going to get stressed and anxious because you're falling behind in school? So we prolonged some recovery by how we were treating these athletes, putting them in a dark room, all those things. We actually were making it a little bit worse. It's only been within, I don't know, a few years where we've kind of gotten away from, it's a brain chemistry issue, not a brain bleed issue. And that was the kind of the thought, is that we don't want to raise blood pressure. We don't want to do anything that could cause those little capillaries to burst open and have more bleeding. But we know now that it has nothing to do with the brain bleeding. It is truly brain chemistry. And as you said, every concussion is different because of the different parts of the brain that are affected and what you bring into it.
And my role as a physical therapist is oftentimes helping them understand what returning to exercises versus returning to play. Also learning, how to modify. Yes, they're being allowed to look at their screens, but where is the symptom and where are you feeling symptoms and where can we modify that? Can you close your eyes for a few seconds and then open them back up? And then same thing with just sitting in a classroom. Sometimes that's overwhelming. So I work with them with strategies of how to work on that. So a lot of times I see patients and I'll talk for 45 minutes versus actually treat them. Or what you think of physical therapy is treating, because I'm trying to guide them in that direction because they get these guidelines. They're like, oh, I was told I can exercise, so I guess I'm gonna go run the track. I'm like, no, you can walk maybe a lap and then see how you feel, and then maybe 2, and just trying to teach them how to return to these activities. And again, I see them past the 10 to 14 days typically because they don't recover as easily.
And we do have assessments to not only assess neurocognitive status, but also to assess them from an exertional standpoint, either on the treadmill or on an exercise bike. It's a little bit like cardiac rehab or cardiac testing, where you see where their symptoms show up, and then we try to keep their heart rate and monitor their heart rate while we're doing the exercise testing, and then we can tell them to train, keep your heart rate at under 130 beats per minute, because when you get up to 140, that seems to be when your symptoms arise. So we have some science behind even how we can determine how much exertion they can do as well.
There's been some recent articles too in kids, specifically in adolescents, where if they were put on an exercise program within the first week of injury, that they, and this was comparing them to a stretching group. So a low aerobic group versus a stretching group. The stretching group recovered in 21 days, as would be expected. The low subthreshold exercise group is how I would phrase it, recovered in 13 days, and they all had the treadmill or bike test done within the first 5 days of injury. And so that's also been very helpful, because I can write an exercise prescription, whether or not the patient follows it. Sometimes I can send it with them to see Megan, and then that's sometimes a better way to try and capture them and get them to exercise within the recommended parameters. And some of the physical therapists are also doing the same test, which is helpful. And it's probably been the most useful thing that I've been able to capture people. And sometimes you've found like different heart rates and blood pressure responses to exercise, which then goes into they're almost having autonomic dysfunction, which is just where their heart rate and their nerves and their cardiovascular system isn't necessarily working together correctly. But it's been very useful. It also helps glean a little bit of black and white in terms of where they are at as individuals. And then it's a treatment also. And I think the first article that started changing my practice, I think came out in 2015, where it was comparing kids with prolonged rest and usual care, is how the article was written. There's 1 to 2 days of rest versus 5 days or longer of rest. And the kids who were 5 days or longer of rest had more daily symptoms or more at risk of developing post-concussive syndrome, whatever that blanket term really means, versus the ones who had short-term rest or usual care, and they were less likely to develop post-concussive symptoms, and they all recovered though at the same rate in general. So it was one of those sentinel articles where it completely changed my practice even before the new guidelines had come out.
So, did you have a question?
Yeah.
Okay, just a second. I'll grab that.
I just wanted to know whether there are any validated pre and post injury kind of testing. I know for a while they were looking at certain screenings prior to football season and then post testing after injury.
So there is a lot of research about balance testing, about neurocognitive testing, impact testing, and then my mind's blanking tonight. And then also, I'll talk a little bit about that. I'll talk more about that. The impact test was a company that created this great neurocognitive test. The school districts all bought it. It's about $10 a kid for initial test. So on an annual basis, that's quite a chunk of money. The problem is that I can tell you, even with college kids, if you're putting them usually in a room, at the high school level, you're putting them in a library where they're sitting shoulder to shoulder. They're 14, 15, 16-year-old kids. Some of them think that if they do poorly on the test, that'll help them out when they get a concussion, so they can get back sooner because their test scores are lower. We do balance assessments. The problem with balance assessments are, again, you have to have a large number of people helping with the testing, and it's a little bit of a cattle call, so it's not exactly valid results. What we've gone to is VOMS and King Devick, which are two different assessments, but post-injury we use VOMS, the vestibular oculomotor screen. Megan can speak to that also. That's somewhat sensitive and has been very useful in assessing concussions. King Devick is a eye tracking, and that you just literally read numbers across a sheet. It's a specific way they're arranged, and you have to now purchase the test. But it's useful. There's a company out of Stanford that has some eye tracking. It has like a headgear and eye tracking software that they're using that for. You can use it for pre and post to establish a baseline. But I would, there's also the Dynavision, which is the light board that has lights on it. That's useful. But again, when you're talking about, so at the high school, I would have, in the fall, I would have a freshman and a varsity and a JV team of each sport. So with football, volleyball, girls soccer, cross country, anyway, it was a number of athletes. And so trying to do that type of testing was nearly impossible. The impact test was the easiest in that you just put them all in front of the computer in the library and let them go. But overwhelmingly, the results are not valid and not particularly useful in comparison with the post-injury test. So that's kind of what we've run into.
And they don't replace what Dr. Gazzardo does by any means.
No.
Right, but that's, I mean, that's a complex evaluation. The screeners have a lot of, the pros are that they're quick and you can do them repeatedly, but the cons are really the same. The impact test doesn't have good reliability, so even if we gave it to people in here today with no concussion and then gave it to you 4 weeks or 8 weeks or 5 months from now, your scores could go down despite not having a concussion, or they could go up. So that's not very helpful. I see a lot of people will call and want to have a neuropsych eval shortly after a concussion, which I typically discourage because of the natural recovery period. Especially if it's a minor concussion and it's 1 or even 2, I say wait and see if if the symptoms persist, then I would want to see them for a neuropsych eval. But to come in a week, a month, 3 months even after a minor concussion, I think is too soon. But after that, I would start to be concerned that there's other factors that are contributing to the concussion symptoms that aren't necessarily actually concussion symptoms. And then I would want to see that person to do a full neuropsych and psych just to see, there could be environmental factors, stressors, pre-injury, developmental problems, learning disabilities, ADHD, depression, family factors. I mean, that's when you really start getting into the whole history to try to figure out why these symptoms haven't resolved yet, because it's unusual for them not to resolve in a mild concussion.
So how does the culture of sports impact the treatment of a concussion or TBI? And how might that affect the integration of getting back into everything that they're used to?
Some of my most useful people in helping me manage athletes are coaches, and some of my biggest obstacles in managing athlete welfare and health are coaches. And that's regardless of whether it's an ankle sprain or a concussion. It kind of depends upon the adults that work with the kids. That has a huge effect. One of the things that's changed over the last 5 years is that we've done a better job of educating kids, and so they're more willing to self-report and to report teammates. Unfortunately, we still have adults who don't necessarily, because of their own experiences or their biases and their tribal mentality with sport, that will. We're blessed in Spokane. We have athletic trainers at almost all of the area city high schools and area high schools. So we have someone who is on site, who can communicate with the athletes and sees them on a day-to-day basis. It's not like they're just walking into their offices and they don't know them at all. There's someone that knows the kid a little bit. And so those relationships have really helped, and the expertise that the athletic trainers bring helps. But we're still trying to educate teachers and coaches about the negative effects of not letting us know when kids are hurt. And again, concussions being part of that, but it's also shin pain with the cross-country athlete and shoulder pain with the baseball player.
So we have a question.
I just have a question. my son played hockey at Riverfront Park when there was hockey. Are there the coaches for those types of teams being taught this at all, or is there any connection? Because I remember him getting concussions.
There's definitely, I think, to protect their sporting organizations is really where it's come from. And so they, at least all the youth sports organizations that I know about, provide some sort of concussion education, but that's loose. So it could be you need to go to the CDC website and watch a video. It could be a formal presentation where they're making them sit down, but it's pretty variable is my understanding.
This was in 2006,
So that was definitely before anything, because the LISTAT law wasn't even around in 2006.
And it's been beneficial to have professional athletes, especially in sports like hockey, that have had to retire because of concussions. It's made it a little bit more. And they've changed rules about with hitting for kids, and so there has been, in the last 5 years, there has been a shift, a definite shift.
I still come across issues with the parents, especially not as much of the high school players or school play. It's more of the club play because they're paying lots of money for these baseball and football, mostly baseball around here in soccer. In Texas, it's football. So it's the parents that they don't know as much because they're not required to go look at a website and watch the video. And they're just like, well, I had concussions and I turned out fine. I'm like, well, did you?
And actually, they have to sign a form every year with high school sports, and we'd like to get club sports to follow the same protocol, but they have to sign a form every year saying that they are aware of concussion and have some sort of concussion education.
Yeah, because it's hard to get the parents sometimes to, well, they're like, well, they're just moody because they're teenagers. I'm like, well, it could be their concussion too. Or because the parents are like, well, can they play next week? I'm like, no, they can't play next week. And so I see them next week. Can they play next week? No, we haven't released you. Your doctor hasn't released you. So sometimes they're the issue. But it's because of education, I think, with them.
Well, and it's also just, they don't tend to take it seriously. I've had parents tell me with an athlete that had a significant quad strain, well, she has a week off in 4 weeks. Can she just keep playing until that week off? Like, well, she's not going to get better continuing to play. So yeah, so that's what I meant as adults, coaches. The coaches in youth sports have a tough job in that their livelihood depends on parents continuing to pay for their kid to be on that team. So they're not going to necessarily be negative to the parents. So if the parent's complaining, my kid's still out, that darn doctor won't release them, or that athletic trainer, or that physical therapist, or whomever won't release them, the coach is going to commiserate with them. Yeah, it's just dumb. I don't understand why. They're just, so crazy about it. Because that's kind of their bread and butter. I'm not saying that they're all like that. They're not. And not all parents are like that. And not all coaches are, in general are like that. But it is part of the culture and is part of the, And I love your line, Megan, are you really okay? Because that's the problem is we don't know what, like I was talking about with my athlete, we don't know what that athlete may have achieved without having the brain injuries.
Fun. So I was a parent that wasn't okay as a kid that got injured as a 10-year-old on a bicycle and then later repeatedly in soccer. And I have 4 kids, and my anxiety around concussions in sports plays in the we're just going to sit at home and not play sports. So can you speak to safety protocols in sports for kids so my kids don't become bubble children because of my own concussion anxiety around sports? Because I know there are lots of kids that play sports that don't get concussions. But my own experience, because I did have an issue that didn't get addressed, is playing into my parenting. So my question is, can we clarify safe playing in sports that it alleviate my anxiety so that they don't get concussions and end up getting treatments.
Some of the things I tend to tell my parents that do get overly cautious sometimes is the more you know, the more you're aware of things, and make it okay for your son to be like, no, Mom, I don't feel right, or no, Mom, I have a headache, or even your daughter, any competitive athlete, to have that open talk with you and know that, I'm not going to be mad if you can't play this week. So I kind of help the parents know about, kind of work into that, as well as cross training, like sports. Get in as many sports as your kid wants to be involved in, and don't isolate. I'm just going to play baseball year round, because we do know strengthening and endurance is different for every sport. And the more you train your body in different ways, the more you're able to adapt to different hits and to different forces through your body. If you're a little stronger in multiple things, and then your reactions are better, your balance is better if you're cross sport play. Those are the two things I tend to say.
I think it's really important. It's education. You need to be educated. So for you, we're all still learning 2006, making changes in practice. We're constantly learning, and I think that that's the key, is educating and making sure that you're comfortable with the people that your children are playing with. Those that are in control, just check it out, because then you'll be a little more comfortable with what's going on. Get to know the coach or whoever is in charge and the athletic director. And education is the key. We're trying to get into the schools, get into the kids, and teach at the level that they're coming from, and that's critical.
I would also encourage you just to remember that a mild concussion, that your child will recover from that. The thing that could interfere with that recovery, though, would be your anxiety. And so that the best thing we can do for people who show up in emergency rooms with concussions is to say you're going to make a full recovery. If more physicians in emergency rooms said that to people who had mild concussions, we would have a lot fewer people with prolonged post-concussive symptoms. But if your child has a concussion and you start to fret and worry and seek lots of medical care, that potentially will prolong the recovery. So that's just something to keep in mind as a family, as a mom, managing your own distress. Because then if the child does sort of pick up on that and start to have prolonged symptoms, now you're going to be worried the symptoms aren't going away, and that could just be kind of a vicious cycle. So maybe just managing some of your own anxiety first would be helpful in the long run.
And the question you raise is a good one, because that's been the fear with all of the publicity on concussion, is that we're going to actually encourage parents and kids to be less active. That's not the point. We average about 30 concussions a year at the high school, and that is with literally 600 athletes. And the majority of those concussions never see any of these people. They're recovering within that 3-week time frame. So because there's been a lot of hype, a few years ago we had a lot of hype about ACL injuries, and everybody was freaked out about ACL injuries. Those numbers have only increased, but yet you don't hear about it as much, just because it didn't become as cool as talking about concussions. But I also encourage parents to broaden what their thoughts are of what their kid being active is. It could be, riding a bike. It can be bowling. It doesn't necessarily have to be a team sport. So that's something else. Is it doesn't necessarily your kid doesn't have to play soccer or football, or it can be other ways of finding activity, playing tennis, a whole variety of things.
And I think the biggest problem with fear of concussion is inactivity. And some people coin it exercise deficit disorder. But what really kills Americans, right, is strokes, heart disease, diabetes. And how many people actually die from a concussion? It should be zero, right? There is rapid onset, like malignant cerebral edema and stuff, which is a different issue. But true concussions, they recover, they do fine, they won't die from it. But if we're holding people out of just recreation, not even sports, but recreation, because we're fearful of that. I think that's where we need to frame shift ourselves and our fear a little bit, just as a nation, honestly.
We have another question from the audience.
Thank you for the question. So we're talking about youth athletes and post-concussion and prevention, et cetera. I was a professional baseball catcher for 5 years, played collegiate baseball as well. Now they're doing a big study on the foul tips off the mask, and I'm working at a chiropractic clinic. We see some injuries, so I'm really in tune with it. Took it upon myself to go get tested over in Seattle, got a spec scan, some other stuff done, found out there is brain injury. What stuff is out there for people with, I stopped playing 10 years ago and I'm still seeing situations that caused me to go get checked and get tested because I was losing my eyesight and hearing and headaches and irritability. All the stuff that was mentioned was every day. And my wife was like, who are you? And so what else is out there? Because I know there's other guys that I played with that are dealing with the same stuff. They're turning to drinking and alcohol and drugs and et cetera because they're just trying to deflect the pain. And it's been years since we retired. So post years of undiagnosed concussions. Big question, I know.
It's again, that's why I was kind of trying to talk about my former athletes. I have a friend who has a 70-something-year-old husband who played quarterback in the NFL and now has a whole host of problems. And thankfully, the NFL has somewhat of a system set up for retired players. But you as a college baseball player, regardless if you're playing pro, doesn't really have that same support system. So what's out there? There's a lot of sham science. There's a lot of very expensive treatments that there is no proof that it works. It's still a very young and new area. This is someone who we recommend. She's been on our resource list for 3 years now. Supposed to finally meet you because she's so hard to get into. No, she's very accessible. Anyway, you're right. So the answer is, I think for all of us is that there is no definitive answer for you right now. The key thing that I would say is the fact that you recognize what you're going through. You go to your alumni games and you talk to your friends about what's going on. So that whatever you're feeling, it may be a result of running into the wall 5 times, okay, or taking 20 foul tips off. Because again, I have worked with 8 different college baseball teams. I worry about these things. I try not to get anxious about it, but I do worry about this. This is something that is a concern for me. So right now, again, I know there's a place in Salt Lake City that has a lot of publicity, but none of it's proven. But it's coming. There are people doing amazing research, and so in the next 2 years, I think that there will be some brainwave treatments and some things that maybe actually are viable.
And I think it's also helpful because medical providers for a long time have just called it a concussion, and we don't know how to treat concussions. And that's where I also shifted my practices to label things that they're dealing with, whether it's neck pain, whether it's cognitive dysfunction, whether it's attentional issues, depression, migraines, post-traumatic headaches, and actually calling it what it is, because those things we know how to treat better as practitioners, right? Just in general. But if we can't call it or label it something, then it's this big hogwash of stuff that I've had other doctors tell me, like, it's a concussion, I don't know what to do. And like, you should follow up with them, like see them and try to identify issues that might be coming up and then label it. And that's at least—
And treat what you label.
And then treat what you label. And I think that's been a shift, at least in my own practice over the last few years. And I'm trying to share that with other practitioners. But again, what's coming out in research now takes about 10 years to get into practice for the average healthcare provider. And so it's a big shift, and because concussion research is changing so rapidly, I think it's a fire hose and people not being able to hold on to it, right? So.
And the military also is helping because they're doing some great research as well.
And I think that can be difficult too because it's the treatment can be fractured if you're not in one hospital setting or research hospital where you can get all of the treatments. But treating what you can treat, would include going to different specialists if you need to have a neuropsychological evaluation. If PT,
Neuro-ophthalmology.
right, therapy, mindfulness meditation, that there's a lot going on with mindfulness meditation now in terms of treating chronic pain, anxiety. But again, it's kind of searching out the different providers for the difficulty you're having. And a neuropsychologist, and that may be what you did in Seattle, I don't know, would assess all of those things and then say, go see this person, go see this person, and go see, which is a pain.
Yeah.
But that's all that we have really right now.
Well, and as PTs, like if you have low back pain, that's like a common one. Everyone has low back pain, right? I don't treat everyone with low back pain the same way. You know, you treat, do they have leg weakness? Are they having nerve issues? Are they having core, you know, is their core weak? Are their glutes weak? You know, there's a huge amount of things that can be going on with low back pain. But we get the diagnosis of low back pain. So I don't treat low back pain. I tell people this all the time. I'll treat what's going on with you and your dysfunctions and what's limiting you in your functional mobility throughout life. Same thing with concussions. I can't see your concussion, but I can see how it's being brought out with your activities and with your you know, I'm having trouble reading a computer. I'm having trouble taking tests at school. I'm having trouble with. They'll tell me all these things, and then we kind of brainstorm and try to figure out what we can actually treat. I have patients right now that had a concussion 30 years ago, and they're like, but my neck is good. I can't move my neck. Well, a lot of times it's because you had an undiagnosed whiplash injury, and now you have a lot of myriad of injury symptoms, and now your spine has changed and adapted. So you can be treated for concussion issues 30 years from now. It's just identifying what you need help with.
So we have another question in the audience.
So it kind of connects with his question, which is, and I work with Dr. Sonic and the Brain Injury Alliance, and it's just, where is there a platform or an avenue? And I had a son who got a snowboarding concussion and was told by the doctor, go ahead and go back to school, and then Dr. Sonic tested him and was like, no, if you pull him, you know, was actually doing more of the staying in the dark for resting for longer periods of time. So it sounds like there's a lot of different and varying information on the right way to treat, which also leads into my friend who's suffering from brain injury for how long now, which is a little bit the opposite of being overly protective of healing and overly concerned or anxious about the healing, as opposed to when somebody does end up with a life-changing brain injury that they aren't able to recover from. And I guess the point of my question is, where is there, if I get a brain injury or my son has a brain injury, like a list of, you know, here's this panel of people that we're seeing today, a connecting point, this is their specialty, this is their specialty, and even the statistical information that you released about, you know, 15% recover to this degree, 35% recover to this degree, depending on, as you mentioned, the varying, how to kind of gauge that and help us, you know, to have access to the right treatment. Like, I don't think Lori's here from Foundations, and she does the NMRI, the Muscatova neuromuscular reintegration technique, which might be really helpful for someone like you to reintegrate that neuromuscular connection that gets disassociated from trauma. And looking at where are the craniosacral therapists, where are the myofascial release practitioners that are help pulling the trauma out? Because what I find is that it very much does depend on prior traumas. It can kind of overload the fascial system. And so, you know, when I find people aren't recovering, I usually start probing. What was your first injury? What was your first trauma that you remember? And we usually find that there is a backlog of trauma in the tissue. And so that we can start addressing that to help them heal from this event. So there's so much information, and where, like, the symposium is so fabulous, it would be nice if there was more of a kind of a connecting point for us to know who we are in a community that are working on this together to help our people whose lives are so drastically often changed.
That's what the Brain Injury Alliance does. The difficulty in that for Eastern Washington is that we've kind of been under the radar. And everybody goes, well, I didn't know you existed. So the creation of that list and that database is something that I work with all of Eastern Washington, am trying to develop for Eastern Washington. And it's a big job because I have other things that clients that I have to work with assessments that I'm doing. But please come and see me. We'll find what we need to find. Statistically, I'm researching all the time, but statistics can be, just depends on what you're looking at and why you would need that. We need to focus on what you would need. So be happy to help you with that.
So that was what came out of the high school physicians the sports medicine physicians getting together, is we actually put together a resource list that we have provided to anybody, but it's more directed towards high school age athletes, but that doesn't mean that vestibular therapists like Megan are on that list. And we provided that list to Ramona, so she has that list of area providers that have some experience in dealing with concussions. But you're talking about a very complex.
Right.
I mean,
is there
if
a
you want to talk about a
website?
pyramid, I mean, it's the size of the pyramid of Giza of all the different things that we can do. So as far as body workers and fascial therapists, and I've got my little group that I know of that I utilize, but they're so busy that they don't need to market. So we don't necessarily know that they're out there.
I think it's also difficult because there's a lot of misinformation out there and a lot of things that don't work. People claim work that can cost an extraordinary amount of money and take a lot of time that diverts from other more evidence-based treatments. But I think with the explosion of information, the ability to filter that is very difficult. So I think, resources where there's one resource or more evidence-based websites or evidence-based information is really what you want. But even that is misleading because a lot of people say it's evidence-based, but it's based on their own research. And there's no other research that has found the same findings. So it's very difficult. I don't think there's an easy answer, but starting probably locally is.
And I do have a group of people that I work with, but again, they're very difficult to get in to see. I work with Dr. Wiley, vision, 3 months maybe before he can be seen. So there's a limited amount of connections that you can make, and it is so complicated because there's so many things going on. And I'm not a doctor, so I'm not going to try and figure out what you have medically. But I will try and assess what you think that you need and direct you that way. And that's all you can do then is weed through and see if this is something you feel comfortable with.
I also think healthcare fragmentation has also been an issue too. With instead of working collaboratively, especially when CHS moved in, and how there was like a big schism between the collaboration that the two health systems had. And I feel like multi-care moving in is trying to shift that and change that and look at the whole health of the community in general. And so I'm hoping that as they're here in town more, that there's much more collaboration between the different health systems. But I also think that wasn't helpful for this side of the state. But it probably is not helpful for any city, to be honest, because everybody's getting either purchased by bigger systems and then you want to feed your own system because you're trying to make it profitable, and there's all those factors that go into it. So I also think that's one of the problems with it in general.
And we have very limited neurology providers everywhere, but especially in this community. They're very busy people. There's a whole host of things that they see. And I know that even within our own system, I work for multi-care, it's difficult for us to get someone in to see next to impossible who works for our same organization in neurology. So that's part of the problem also and it's not that they don't want to see patients, there's only so many hours in the day, so that becomes part of the problem also.
So there's more need than there are providers at this point.
Definitely.
It kind of sounds like, which leads me to my friend Liz's question, who's a brain injury sufferer and has found really limited resources. And her question is, what do you do if you're an adult and your insurance becomes Medicaid because of non-employment and it doesn't cover treatments and doctors that specialize in brain injury, and someone's just kind of left, really in the cold to try to figure out how to survive? It can be really.
I cannot speak for other people.
St. Luke's that is a nonprofit, and we do have financial assistance programs to try to help people if they have run out of all of their insurance benefits. So if you contact St. Luke's, we have multidisciplinary therapy, physical therapy, occupational speech therapy, psychology, and we treat concussions and brain injury. But we do try to treat those people who don't have insurance. You have to go through a process where you have exhausted your insurance benefits, and then you do an application. But you can get some free care if that becomes a need.
Okay. Sorry if my speech is not good. In 3 years since my car accident, I have still not seen a neurologist or someone that specializes in that part of the brain. And this is the part that's very difficult with Medicaid, because initially they give you all these lists of names of people that you can see, and then when they find out what your insurance is, then the appointments either are canceled or unavailable. So in 3 years' time, I've still not seen someone that specializes other than Dr. Stanek, who saw me after 1 year. And if it was not for her, I would have not had any treatment. And so I think it's important to know that there are a lot of people out there like me that don't know where to go, don't know what our options are. And I did not have a support system, and I did not have a significant other. So I didn't even know what was happening to me. And so I didn't even know how to get help. And so the more resources that we have that people can get early on, to know who to contact, to get this kind of help, even though they don't have proper insurances, will maybe help more people get better sooner, if at all.
Thank you. So I think we have time for one more question, if there is one, right up here.
Raise your hand. I think Ramona talked about education, and I'm kind of wondering about education of emergency department physicians. I think that's a cornerstone to helping the people who are going through this journey, because, sports injury or, falling off the ladder, or older adults falling down because of the balance issues, any of that, they be run to emergency department. What efforts are being made to educate physicians in training now that we have 2 medical schools here? What can we do to have, kind of information about this? And also to educating in general, public as well as coaches and teachers and youngsters who are playing the game, no matter what age. I think education is going to be the thrust of preventing, not following the treatment that needs to be followed. Like you mentioned about what was in early 2000s versus what are the recommendations now for treatment, etc. Because the coaches may be thinking about what was valid, earlier should be just fine. So we need to kind of have yearly, training for the education for the coaches and stuff. And second question I had was, for the sports medicine, you are, treating 18 and under population. What happens to people who are 18 plus as far as sports medicine and this kind of treatment, necessary to coordinate the pieces with physical therapy or neuropsych or whatever other services are necessary? What resources we have? There are a number of sports medicine providers that work with all ages. The provider I work with is a fellowship sports medicine trained provider who works with everyone from age 5 to literally, we had a 93-year-old in clinic today with knee pain. So there are plenty of people out there that work with all ages. I shouldn't say plenty, there are some out there. As far as education goes, that was the purpose of the group and how many meetings have you had with Chaz? Have we had with Chaz to educate them?
Yeah, we've gone to Chaz urgent care providers. I've talked with the pediatric emergency medicine providers at Sacred Heart. I used to work at Sacred Heart too, so I already kind of know them, and they have me come and talk to them every couple of years just to kind of update them on the new things that are out there. Some of our other, I guess, group members have gone to their different health systems urgent cares to at least try to update them. Again, it's a fire hose coming at you in general, and I think when you're talking about medical school education, you already have this breadth of information that you're supposed to pack in your 4 years. Probably some a little bit too detailed for what you really need in traditional practice, but that goes back to the establishment of medical education in the early 1900s, really, when formal medical schools were really created. And so trying to get at least a piece of concussion is probably in their general neurology education section. However, mine in medical school is called brain and behavior. And so they kind of combine the anatomy with the pathophys and the physiology into one course. Other institutions do it differently, but if you have a lecture, you probably have one lecture, if that, or part of a lecture on concussion specifically, because you have to learn neuroanatomy, you have to learn the cellular issues, and all these other factors that go into it. So the root cause of traditional medical education might be hard to address. Residency education is probably a little bit easier because you're taking doctors that are learning their practice. And
whichever level,
Yeah.
if we can have that, and also the primary care physicians, because quite often you may not run to ED right away.
Yeah.
It could be that you go to your family physician.
which most should.
And that leads to continuing education, and that's what providers we're responsible doing. But we get to choose what we do. So even as a physical therapist, I get to choose which classes I go to every year. Mine tend to be more guided towards vestibular, sarcogenic stuff and concussion stuff because that's what I'm interested in. That's what I treat a lot of. And so primary care physicians, they go to their stuff that they either see a lot more of in their clinic. And so until they get a lot of people asking for it and demanding it and requesting that information, they're not going to go to those continuing ed courses because they didn't get that much in school and it wasn't their interest, unless it is their interest. And that's hard, and that's where becoming your own best advocate. I mean, in the medical community, you have to be your own best advocate, and it's really hard when you don't know how to do that. And we understand that. And I know as a physical therapist, I spend my evenings going to things like this, and I go and if I have an afternoon that's slow or something, which is very rare, I go and I talk to doctors and I let them know what we can do for their patients, and that's the best thing we can do. And then hopefully that gets down to the patients.
The other issue too can be that, now I'm not a physician, so for me to crack that wall and get in there, even though I'm a certified brain specialist, I can't get in there because who am I? They don't know me. So there's that attitude that we have to break down first. And again, it's just, there's one doctor. I mean, look how many of us are here, and it's hard to get out there and try and do it one person at a time. But we're working at it.
But thank you for all you do.
And you can lead a horse to water.
But you can't.
You can lead a horse to water. We do grand rounds every year with multi-care, with concussion being the topic. But if people don't, if that 7 a.m. time slot doesn't fit into their day, because they deal with concussion once a month and they're dealing with a whole host of other things more often, it's not on their priority list. It's passionate for us, but it's because again, it was a problem that we were seeing at the school levels and with our college athletes and with when I work professional teams, professional athletes. But we also have to stay current on a whole myriad of other different types of care as well. So it's, like you said, it's a fire hose.
And the research. There's so much research. So, I'm sure we all spend a lot of our time reading the newest journal articles and changes in treatment, best practice, but there's research coming out all the time, and I think probably for some primary care docs, it's hard. They don't have the time to see 60 people a day and then go home and
stay current with research.
Stay current with research.
I attended a presentation from a doctor years ago, and he said that I try to read one article each day. He said that means if I read one every day, it's 365 a year. There were over 10,000 articles published each year in his area of medicine alone. So this is, and you have to go through, you have to sift through it a lot. On the website for this presentation, it talks about there's a new blood test that they can determine if you have a concussion or not. That was kind of the CBS News press release. It's not particularly accurate. There's a blood test that's been determined that detects levels of inflammatory markers, of which concussion kind of shows up in that. But let's say you have a bruised shoulder and a concussion, or you have your inflammatory. My point being is that this little bit of research comes out and it gets blown up to be this huge life-solving problem. I mean, it's a solution, and it's not accurate. So even then, it's because that becomes a problem of trying to sift through all of the research that comes out and all the information that comes out and figure out what is actually helpful and accurate.
And one thing I feel as a consumer, corporate medicine requires doctors to see so many patients for just so limited number of times. If they could also incorporate some time for education on a variety of issues, that'll improve the population health in general. Thank you. Thank you for all you do.
Okay, we can do one quick question that we have to wrap up. Okay.
You guys were talking about the impact tests not being really accurate. What were the screening tests that were out there that were more accurate?
For pre-injury or just post-injury testing?
Post-injury testing.
VOMS, the vestibular ocular motor screen, VOMS.
Which is a physical exam, basically test that also helps guide treatment, to be honest. So it not only is fairly accurate, like in the 90% plus range, but then when you identify things on there, you can actually then direct treatment based off of it, which is also useful. But that's been, ever since I started incorporating it, that's been the most useful thing. It was developed out of the University of Pittsburgh, which is also the place to develop impact tests, but by a physical therapist there called Luca. And it's very useful. And I think that's what KD is trying to measure, is really saccades, which is one of the components. If you flag on the VOMS positive, you're much more likely to have a prolonged recovery. If your convergence is off, which is your close vision, that can prolong your recovery, which is one of the measures on it. So it's, but then you can direct treatment, and that's when I send people to Megan and things honestly, if I'm flagging those sort of things, because one, I know it allows me counseling time to say, look, this is average, this is what average is when you flag positive on these things, or you continue playing like they're saying in the video. So it also helps give you a rough guideline for this would be an expected recovery for you, and gives that counseling up front.
Thank you.
All right, so I hate to wrap it up, but we have to end this panel discussion. Thank you to all of our panelists, and thank you for everyone who came. I asked if you could fill out the evaluation that was handed out, and if you didn't get one, they're at the checkout table, or check-in table. They help us to be able to give you guys the information and education that you may need within the community for future events. Also, the last bit of this time, feel free to connect with the different resources that are here, the people that are here. And there's also some refreshments that you're more than welcome to have. So thank you so much for coming.
And I did include some, it's in your folder, there's a concussion resource that's available, some of the available education and otherwise.
Yes.
Sports related concussion resources. It's not Spokane specific, that you would reach out to Ramona for that, for the Brain Injury Alliance of Washington.
And there's a handful of resources in your packets as well that you can utilize. Thank you so much.